Before we begin, a quick note. The opinions and analysis shared on Truth Seekers are our own interpretations of published research and should not be used as medical, financial, or professional advice. Always consult qualified professionals for decisions affecting your health or well-being.
And with that out of the way, welcome to Truth Seekers. I'm Bill Morrison.
And I'm Alex Barrett. Today is January 19th, 2026, and we're talking about, is red meat bad for your heart? It depends who paid for the study. Or does it?
Let's get to the truth.
Right, so the New York Times ran this headline that made me want to throw my phone across the room. Is red meat bad for your heart? It may depend on who funded the study.
Oh, I saw that one. And here's the thing. There's actually a real study behind it, published in the American Journal of Clinical Nutrition.
Which makes it so much worse, doesn't it? Because they're taking legitimate research about funding bias and turning it into this nihilistic, you can't trust any research ever narrative.
Well, hold on. Let me tell you what the study actually found, because the funding bias part is real.
Okay.
Researchers looked at 44 clinical trials on red meat and heart health. Studies with meat industry ties were 3.75 times more likely to report favorable or neutral outcomes compared to independent studies.
That's quite a significant difference.
It is. But here's where it gets interesting. And this is what the headline completely misses. When you dig into the methodology, there's something else going on.
Go on.
So they categorized the studies by what researchers compared red meat to. When they compared beef to plant proteins, things like beans, lentils, tofu, 70% of those studies found unfavorable effects on heart health. Right. But when they compared beef to other animal proteins like chicken or pork, 69% found neutral effects.
Hang on. So, what you're really saying is that red meat looks bad compared to plants, but similar to other meat.
Exactly. And guess which comparison the industry funded studies tended to choose?
Oh, brilliant. They're comparing beef to chicken instead of beef to chickpeas.
Right. Now, that's not necessarily fraud. It's a legitimate research question to ask, is beef worse than other meats?
But it's also a methodological choice that's going to make beef look better than asking, is beef worse than plant proteins?
Exactly.
Okay, but I'm actually going to push back on something here because I think you're making it sound like the comparison group thing is the main issue. But isn't the funding bias itself the bigger problem? Like, they're deliberately choosing the comparison that makes their product look better. That feels more sinister than just methodological nuance.
Huh. I guess I'd say it differently. The comparison choice is what actually determines the result. The funding just predicts which comparison they'll choose.
But they're connected, aren't they? The funding is driving the choice.
Sure, but I think the comparison issue matters even when there's no industry money involved. Like, if an independent researcher compares beef to chicken, they'll get similar results. The biology doesn't care who's paying.
Okay, that's actually a fair point. So you're saying the funding bias shows up in how the question gets framed, not in the data itself?
Yeah, mostly. Though there are other ways funding can influence things: publication bias, selective reporting, interpretation. But the comparison group thing, that's just that's the question they chose to ask, and the answer follows from that.
All right. I think I still find the funding part more troubling because it's deliberate, but I take your point that the comparison matters regardless of who's paying.
And they're both worth paying attention to. I'm not saying ignore the funding.
Okay, so walk me through the biology then, because if we're saying the comparison determines the result, what's actually happening in the body?
Right, so let's talk about what we actually know, independent of who's paying for what. Saturated fat raises LDL cholesterol. That's been established over decades of research from multiple sources. Okay, and LDL cholesterol is a causal risk factor for heart disease.
So that mechanism exists regardless of whether the Beef Council is funding a study or not.
Correct. Red meat, especially fatty cuts, contains saturated fat. That's just biochemistry. The question is whether the amount in unprocessed lean beef translates to meaningful cardiovascular harm in real people eating real diets.
And that's where it gets complicated.
That's where it gets really complicated. Because short term controlled trials, the kind where researchers feed people specific diets for a few months, mostly show minimal effects on cholesterol and blood pressure. Hmm. But long term observational studies, where they just track what people eat over years, show associations with heart disease.
Why the difference?
Confounding. People who eat lots of red meat differ in lots of other ways. They might exercise less, eat fewer vegetables, smoke more. Observational studies try to control for that, but you can never get it all.
Hang on, this is reminding me of something. Didn't we do an episode about this exact problem? The chocolate and diabetes thing?
Oh, yeah, where the people eating dark chocolate were just healthier overall.
Right, exactly. Same confounding issue. You can't tell if it's the food or everything else about the people eating it.
Same methodological problem. Yeah, it keeps coming up in nutrition research.
Anyway, what were we saying about the observational studies? You were explaining why they differ from the controlled trials.
Right, so observational studies show associations, but confounding is always the issue. You can control for some factors, but not everything.
But if funding bias is influencing everything, wouldn't that explain the difference too? Between the trial types?
Here's where the entirely part of that headline really falls apart. There's this massive study called Pure. Wait, actually, let me back up. I should explain what makes this one different first.
Okay.
So, Pure tracked over 134,000 people across 21 countries for nearly a decade. No apparent meat industry funding. And they found no significant association between unprocessed red meat and cardiovascular disease or mortality.
Wait, seriously?
Yeah, and there's also these newer genetic studies, Mendelian randomization, where they use genetic variants to test causality.
How does that work?
Okay, so this is actually really clever. Instead of just looking at who eats meat, you look at genetic variants that influence meat consumption patterns. Because genetics are randomly assigned at birth, it's kind of like nature's randomized trial. And those studies also found no causal link between red meat consumption and heart disease risk.
Huh, that's actually quite good methodology.
Right? It gets around the confounding problem in a really elegant way.
So we've got independent evidence that doesn't fit the industry funding determines everything narrative.
Exactly. Which doesn't mean the funding bias isn't real. It definitely is. It means the actual science is messier than the headline suggests.
Okay, but I'm still wondering about something. The original study found that 73% of independent studies reported unfavourable outcomes. That's a pretty stark pattern, isn't it?
Wait, I think you might be mixing numbers. It was 70% of studies comparing meat to plants that found unfavorable outcomes, not 73% of independent studies.
Oh, right. Got it.
But there's a crucial detail about all of this. The researchers rated all of the evidence, both industry funded and independent, as very low to low quality.
Meaning even the independent studies showing harm aren't particularly strong evidence.
Exactly. Most of these are small, short term trials that measure biomarkers, not actual heart attacks or strokes. The evidence base is just weak across the board.
Which brings me back to why this headline is so frustrating. Yeah? It's taking a real problem, funding bias in nutrition research, which absolutely exists, and oversimplifying it into this binary thing where you either trust big meat or you think all red meat will kill you. And when I was working in journalism, this is exactly the kind of framing that would just shut down actual understanding, you know? Because people read that headline and think, well, I can't trust any of it, so I'll just do whatever. Right. And there are people with heart disease risk who need actual information, not just all studies are corrupted, good luck figuring it out yourself.
That's the real danger of the entirely framing. Because funding bias is something we should absolutely pay attention to. It's a real factor that shapes how studies are designed, which results get published, how findings are interpreted.
But it's not the only factor.
Not even close. Study design matters, sample size matters. Whether you're measuring short term biomarkers or long term health outcomes matters. What you're comparing red meat to matters enormously, as we've seen.
And when you reduce all of that complexity to follow the money, you're actually making people less capable of thinking critically about research.
Yeah, because then the only tool you have is who funded this, rather than what did they actually measure? How did they measure it? What did they compare it to? What are the limitations? Right, which are all questions I had to learn to ask when I was working as a data scientist. And actually, this reminds me of, when we do A B testing, you could always make your feature look better by choosing the right control group. Like, if you wanted a new button design to win, you'd test it against the ugliest possible alternative instead of the current default. Same principle.
That's interesting, but is that really the same thing as what's happening here?
Well, kind of. The point is that choosing your comparison determines.
Okay, but we're talking about nutrition studies, not button colours. Can we stay on track?
Right, sorry. The point is that the funding question is part of evaluating research, but it's not the whole thing. I've seen plenty of industry funded research that was methodologically sound, and I've seen independent research that was a mess.
And the headline makes it sound like funding determines everything, like there's no underlying biology at all.
Exactly.
It also conflates processed and unprocessed meat, which is a huge distinction. There's pretty strong consensus that processed red meat, bacon, deli meats, sausages, increases cardiovascular risk. That's not really debated, is it?
No, that evidence is much stronger. Because of the sodium and nitrates, not just the saturated fat. The debate is specifically about unprocessed beef, and that debate exists even among independent researchers.
So, when the American Heart Association says to limit red meat, what are they actually basing that on?
They're being precautionary. The mechanism is plausible. Saturated fat raises LDL, and some observational studies show associations. But they also acknowledge the evidence is weaker than for processed meat, and they specifically say lean cuts are better.
Which suggests it's not red meat as a category, but the amount and type of fat in particular cuts.
Right, a lean sirloin and a fatty ribeye are very different things nutritionally, but most studies don't make that distinction carefully.
Here's what I keep coming back to though. Hmm. When I see a headline like this, I think about what it does to people's relationship with research. If the message is funding determines everything, why would anyone trust any study about anything? It's this corrosive cynicism that just it makes it impossible to have informed public health conversations.
That's exactly it. Because funding bias is something we should absolutely pay attention to, it's a real factor.
But it's not the only factor.
Right. And when you reduce all of that complexity to follow the money, you're actually giving people a worse tool for thinking about science. Because then they stop looking at methodology, at sample size, at what's actually being measured.
At whether you're comparing beef to chickpeas or beef to chicken.
Exactly. Red meat versus what is a really important question. And that's where a lot of the funding bias actually shows up, not in faking data, but in choosing research questions and comparisons that are more likely to show favorable results.
Which is subtle.
Very subtle, which is why the follow the money shorthand is tempting but incomplete.
So, what should people actually take away from this?
If you're worried about heart health, the clearest evidence is still about processed meat. That's worth limiting. For unprocessed red meat, especially lean cuts, the evidence is genuinely mixed. Independent large studies show minimal risk, but the mechanism for potential harm exists.
So, it's not unreasonable to choose to limit it, but it's also not unreasonable to include moderate amounts, especially lean cuts, as part of an overall healthy diet.
That's pretty much where the evidence lands. Yeah,
Which is frustrating if you want a simple answer,
it is. But it's actually what honest uncertainty looks like.
as opposed to false certainty that just depends on which headline you happen to click on.
Exactly. And there are legitimate reasons someone might choose to limit red meat that have nothing to do with whether the Cattlemen's Association funded a study. Environmental concerns, sustainability, ethical considerations, those are all separate questions.
But this study was specifically about cardiovascular health and funding bias.
Right. And the real lesson isn't you can't trust research or funding determines everything. It's more like funding creates real biases, especially in study design and interpretation. But there's still actual biology underneath, and reasonable people looking at the same evidence can reach different conclusions.
That's way less catchy than follow the money.
True, but it's more true and more useful.
Because it gives people actual tools for thinking about research rather than just blanket cynicism.
Look at the funding, yes, but also look at the methodology, the comparison groups, the size and quality of the evidence, and whether independent lines of evidence point in the same direction.
And in this case, independent evidence complicates the narrative in both directions, some showing no harm, some showing harm, depending on what you're measuring and comparing to.
Which is frustrating, but that's what the science actually shows right now.
Right. Messy, but honest.
Yeah,
Right, that's all for today's dive into the data. Just remember, everything we've discussed is our interpretation of published research and shouldn't replace professional medical advice.
absolutely. If you're dealing with health or mental concerns, talk to your doctor, not just us data nerds on a podcast.
I'm Alex Barrett,
And I'm Bill Morrison
and we'll see you next time.
on Truth Seekers.
Until then, question everything.
But verify with data.